Thanks everyone for joining us today. It's my great pleasure that we're going to have a session dedicated on Spain's efforts to strengthen access to antibiotics. So we're looking forward to 4 very exciting presentations. And I think Antonio Lopez Navas is going to open up first and set the scene. So Antonio, the floor is yours.
Thank you so much, Christina and Sofia, for organizing and letting us to give you a space in your work package to presenting some of the action related to the work package we are conducting in Spain. As Christina said, my name is Antonio Lopez. I am the coordinator of the Spanish Action Plan on Antimicrobial Resistance in human health. The purpose of our presentation is to present what we are doing, what the Spanish health authorities are performing regarding the different topics that were discussed in the meeting, a very interesting meeting we had May last year in Copenhagen. So we consider it important to have this meeting and explain a little bit about what we are doing. To share knowledge and maybe inspire some other countries. For us, for the Spanish Action Plan, ensuring the sustainable and equitable access to antimicrobials is one of the key pillars of the Spanish Action Plan. It is for the human medicines, but also for the veterinary medicines. In Spain, you all know that all the activities related to AMR are framing our Spanish Action Plan. And in relation to access, the first thing I want to say is that all the actions that we've considered within the National Action Plan are aimed at to accompany antimicrobials throughout their entire regulatory life cycle, meaning that it's from research, including development, marketing authorization, and several post-marketing activities. And today we will touch some of them. I will give some examples. For example, again, talking about this life cycle of the medicines in general, but in particular antimicrobials, our approach as National Action Plan starts with in the earliest phases, where, for example, research funding mechanisms in Spain now incorporate, among others, obviously, but incorporate prioritization criteria to support projects addressing antimicrobial resistance. Another example, the Spanish Medicines Agency, or the Spanish Agency for Medicines and Medical Devices, offer free scientific advice to medicines or alternatives aiming to tackle unmet medical needs related to antimicrobial resistance, ideally helping to accelerate the development pathways for these innovative antibiotics or alternatives. An additional activity we can offer in these initial phases from research, once the antibiotic gets to the marketing authorization phase, we offer a fast track for marketing authorization application related to AMR. From the Spanish Medicines Agency, we also develop some regulatory frameworks for alternatives that are still not out there in Europe. For example, we already have a regulatory framework for fecal microbiota transplantation, and we are currently discussing the framework for using phage therapy in the human side. I'm talking about in Spain. So these are examples from this pre-authorization phase. But once the medicines reach the market, our responsibility as country continue across several dimensions. We monitor and promote responsible use through different initiatives, such as the antimicrobial stewardship focal points, the framework for antimicrobial certification. We work to ensure the continuity of supply through the strategic medicines supply warranty plan, which is coordinated by the Spanish Agency. As part of the supply warranty plan, we work on a national prioritization exercise identifying the list of strategic medicines, of which more than 20% are antimicrobials. This list of priority medicines serve later as one of the key elements or reference points for the European Medicines Agency in this exercise to identify these strategic medicines at the European level. In parallel, in Spain, we've developed a pharmaceutical industry strategy as an example of public-private collaboration. This pharmaceutical industry strategy, like our National Action Plan, covers the full cycle of medicines, and its structure several key pillars, but it's important to mention that antimicrobial resistance is one of the strategy priority areas included in this pharmaceutical industry plan. Overall access in Spain is, we think the access in Spain is approached in a holistically manner. Today, my colleagues will take you through this or through several of these key initiatives. We've prepared a set of presentations to show how the Spanish Medicines Agency, the Ministry of Health, through the National Health System and Pharmacy Directorate, several initiatives, and how our role as regulatory bodies try to guarantee the supply and the access to antibiotics. So Patricia will address issues related to warranty of supply. Then I think one of the topics that were discussed and presented in Copenhagen was this experience implementing the electronic product information, as Spain is leading the national pilot and is providing and is leading this electronic product information for centralized approved medicines. We consider important that the product owner present today more in detail the project. And after that, my colleagues from the Ministry of Health, Sonia, will outline the legislative strategies that we are conducting right now, shaping the access of medicine in Spain, and some details of this pharmaceutical industry national strategy plan. And finally, Mercedes will explain how is the pricing strategy of the Ministry of Health designed to support the access to essential antibiotics. I think together, all these perspectives will provide a comprehensive overview on how in Spain how we are working intensively right now, but over the past years, and also trying to do at the international level to tackle supply problems and shortages and to ensure the availability of medicines. So Christine, again, thank you very so much for giving us this opportunity. And I think now I hand over to Patricia to open the first presentation.
Okay, good afternoon, everyone. I'm going to share my screen. Okay. Can you see my screen? Can you see my slides?
Perfectly. Thank you so much.
Okay, perfect. So good afternoon, everyone. Thank you so much for inviting me to this webinar. My name is Patricia Rodriguez. I work in the International Affairs Division of the agency, giving support to the Executive Director in all of those initiatives that aims to ensure the access not only to medicines, but also to medical countermeasures. And I've given a little support to Blanca in the elaboration of the barrier analysis. So that's one of the reasons why I'm here today. The purpose of my presentation is to show you some of the measures that are currently implemented or that are planned to be implemented in the near future in our country in order to prevent shortages. So that's why we consider that it will be interesting for you to know about our supply guarantee plan 2025-2030 that was published last July. And prior to introduce you the plan, I would like to give you a brief context of the reasons why we decided to publish that plan. And in order to do so, it is important to mention that, as you of course are already aware, shortages are a global issue and are a priority not only in national, but also in international agendas. They are an important concern, not only because of the extra efforts that they suppose to healthcare professionals and all of the agents involved in the management of shortages, but also because of the impact that they have in patients. In this regard, it's important to take into consideration that shortages or the resolution of shortages is a complex process because normally they are caused by multiple causes, sometimes interconnected between each other, and also because normally or frequently they are an international issue. So sometimes, or not sometimes, frequently, a national approach is not necessary, and it will be necessary to establish a multi or an international approach in order to achieve more success. So that's why a wide variety of international initiatives and also supranational working groups have been created with the purpose to prevent, to early identify, to monitor and communicate in an effective manner shortages. I'm thinking about, for example, the publication of the Regulation 2022-123 that reinforces the paper of the EMA in the management of shortages in a crisis situation, the Critical Medicines Act, the Pharma Package, a wide variety of initiatives that are current under development. And in this sense, I would like to highlight the high involvement that our agency has in those initiatives. But also, we consider that it's important to reinforce those measures by national measures so that we can avoid shortages and then the impact that they have in patients. So in that context, we decided to publish that supply guarantee plan in order to transfer all of those European measures to the Spanish context, and also to include specific measures so that we can prevent and manage shortages in as best as we can. This is the second edition of the plan. The first one was published on 2019. And it is organized, or it contains 4 objectives. Three main objectives, which are prevention, management, information, and information of shortages, and a transversal one, which is coordination with EU and international partners, and also with stakeholders. We want to improve the participation of stakeholders, such as patients, such as wholesalers, healthcare professionals, among others. Because of time, I won't be able to explain to you in depth the whole plan. So I will give you brief notes of the different activities included in the plan in order to achieve the 4 objectives, but I will be focusing in prevention and specifically in the guarantee of supply of strategic medicines, because we consider that maybe it will be the most interesting topic for this webinar. So let's go now with a brief... Perfect. Let's go now with a brief overview of the whole action plan, and then I will be focusing, as I've mentioned, in the guarantee of supply for strategic medicines. So the different activities contained in the plan in order to comply with the different objectives are, with regard prevention, we have regulatory measures, for example, the evaluation of shortage prevention plan to make it easier, the implementation of multilingual labeling or efficient formats or identify the more efficient formats for patients. Also, we have a control plan for marketed medicines that aims to identify in an early manner quality defects and prevent shortages caused by these quality defects. Also, we want to review the basis for a penalty policy, and we are going to be focusing on a regulatory development. With regard to management of shortages, we are working on the early identification. We want to improve our shortages management tools, to improve actions to obtain therapeutic alternatives and make them available to patients. And also, we are participating in the creation of a national strategic stockpile of medicines. Regarding information, we are trying to optimize public information in our websites. I highly invite you to visit our website because we publish a wide variety of information regarding shortages. For example, we published in a biannual biannual report of shortages with different trends and different we evaluate the shortages that has been occurred in our country, and we assess our results. So for example, on the first half of 2025, we observe a decrease of the 50% of shortages comparing with the first half of 2024. And as I've mentioned, we publish that reports twice a year. Also, we publish, for example, press release of shortages that are considered relevant, a lot of information. So I highly invite you to visit our website. We want also to improve the scope of information and the information to patient representatives and healthcare professionals. And finally, with regard to horizontal principles of action and coordination, we are trying to improve not only our national coordination, but also the coordination with other EU countries. And we want to improve and encourage the stakeholder involvement. As I've mentioned, this supply guarantee plan is published. So if you want, you can go and take a look. And if you want wider information, you can come back to us and we will be happy to give you further information. So now I'll be focusing in the guarantee of supply for strategic medicines. We would like for you to know that we have a strategic medicines list, which contains a subgroup of critical medicines marketed in Spain that need additional actions to ensure their availability. It is a dynamic list that is under regular updates. Currently, we have, I think, more than 700 medicines and more than 300 API. And as Antonio mentioned in his speech, more than the 20% of these products are antimicrobials and around 10% are antibiotics. The first version of this list was published in May 2022. And I would like to share with you a brief overview of the methodology that it was used, because it was the first time that we applied vulnerability criteria. So what the agency did, was to identify those products that are registered in Spain and that are contained in different lists, national or international lists of essential medicines, such as the FDA or the WHO list. So we have a first set of medicines that were registered in Spain and contained in different lists of essential medicines. To that first set of medicines, we apply our first vulnerability criteria, which was the lack of alternatives. We identify those products that had one or two marketing authorization with the same clinical product description. So products that have the same API, the same dosage, and the same pharma form. And to that second set of medicines, we apply two additional criteria: the criticality of the indication and the availability of alternatives, but not talking about API, but talking about indication. So the existence of another product that meet the same indication. And that was our first version. But as I've mentioned, this list is under regular updates. Which are one of those updates that have been applied to the list. For example, per ATC, the agency is now identifying those products that, even though they met the first criteria, they were not included in any previous list of essential medicines, and that are considered necessary in our current clinical practice. Another thing that has been done is, once the union list of critical medicines was published, we apply our methodology and national assessment in order to identify those products that are considered necessary in our country and that are included in the union list of critical medicines. And other criteria that is now taken into consideration is the market share. What has been done is to identify those medicines that were not selected because they were not included in any list of essential medicine. No, sorry, they were included in the source list, but they were not selected because they have 3 or more marketing authorization. And now we are identifying of those products that at the beginning, at the first stage, were not considered vulnerable. Which one has one of the marketing authorization has the 70% of the market share. And here I've showed to you a screenshot of our website. Here you can see that you can find the strategic medicines by API and also by the clinical description. And also you can see the methodology. You can take a look of the methodology because it is published in our website, so you can go and check it in depth. and also the regulatory measures that are put in place or that are planned to put in place in order to ensure the availability of this product in the market. So regarding the measures to ensure their availability, they are also contained in our in our plan of guarantee. And I've put here some of them, for example, the streamlining of administrative and regulatory procedures, giving scientific and regulatory advice to companies, support for internationalization, the integration of the concept of strategic medicines, the monitoring of shortage prevention plan, and the request and assessment of shortage mitigation plan. And I've here highlighted the analysis of dependencies on third countries. What we want to do is to identify dependencies in the manufacturing level and both in medicinal product and API, and correlate it with the incidence of shortages of major impact. When I say major impact is because our agency classified shortages in 4 categories depending on the impact. So we have 0 impact when even though there is a lack of the product in the market, patients don't realize it because there is a short the shortage lasts a short period, so patients didn't realize it. So in the reality, the shortage has no impact. Then we have minor impact, which is when, even though there is a lack in the market of a specific product, we have other alternatives with the same API dosage in pharma form, so that the pharmacists can exchange one for another. We have medium impact when there is no alternatives, but there is the possibility that the physician prescribes another medicine that meets the same indication. And finally, we have major impact when other measures should be in place. For example, the import of foreign product, authorize a product with a shelf life less than 6 months, because neither the pharmacist or the physician can do anything. So we want to correlate that information, the dependencies in the manufacturing at medicinal product and API level with shortages of major impact. With which purpose? Because we want to prioritize those strategic medicines that present greater vulnerability in their supply chain and implement measures, for example, the development of an incentive plan to encourage the national manufacture of these medicines or API in collaboration, of course, with the relevant ministries. And finally, I would like to give you some notes regarding the IAMS cooperation at European level, because as I've mentioned before, we have a high involved in different initiatives, different European initiatives related with shortages. So, for example, our agency participates in the Spoke Working Party of the EMA, and also in the Executive Steering Group on Shortages and Safety of Medicinal Products and their working groups. For example, the working group of the MSSG on the Vulnerability Analysis Methodology. We also cooperate in different initiatives of the European Commission, such as the Chessmen Joint Action, in which Spain leads the Working Package 5, that aims to identify and analyze root causes of shortages. We also participate in the HERA, in the HERA board, and with the IRICOM. And that's all by my side. I hope you have found interesting my presentation. In case you have any question, I'll be happy to take it. And in case I can give you an immediate response, I will come back to you after I contact the specific colleague and give you the information. Thank you so much.
Thank you so much, Patricia. That was wonderful. Sorry, Antonio, you should moderate. Sorry, I didn't mean to.
No,
you go. Sorry.
No, that's fine. We're going to give the floor to Evin, so that's all my moderation here. Thank you so much. So Evin, if you are there, go ahead, please, with the part of the electronic product information leadership from Spain.
Yes, thank you very much. I hope you can hear me.
Yes, loud and clear. Thank you.
Yes, okay, perfect. Let me go ahead and get my presentation up. Just bear with me. Alrighty. Can you see my screen now?
Perfectly, thank you.
Yes.
Oh, Okay, thanks for the confirmation. So hello everyone, my name is Evan Druses. I am the network product owner for EPI meaning electronic product information. And being the network product owner, I am working on behalf of the NCA network and working alongside EMA to develop the EPI common standard and also develop the functionalities of EPI in the EMA's product lifecycle management portal. So today I'll be giving a little background about EPI, also talking about the pilot and our road ahead in terms of EPI. So just to give a little background about EPI, I would like to talk about the evolution. So what we have here on the left, you can see, where we are today with a young lady reading a paper package leaflet. We're all familiar with this leaflet. It comes in the box of all medicines. It's very useful for the patient. However, because it's paper, sometimes it's also lengthy and the font is small, so it's not very useful for visually impaired patients. Because it's paper, it's not searchable. So we need to have some kind of better solution. There have been, moving on here to the second step, are some national solutions that are currently being implemented. Here in Spain, we have CIMA. CIMA is a publicly available online database for medicines authorized in Spain. You can find all sorts of information on CIMA, information about active ingredients, shortages, a plethora of information. And one of those other aspects of CIMA is that we also have an HTML representation of the package leaflet and SMPC. These documents are broken down into sections so they can be more searchable. Because it's digital, you can increase the font size. You can use a screen reader if you're visually impaired. So a very powerful tool indeed. There are also other solutions around Europe. In Sweden, there's FAS. In Norway, there's Felleskatalogen. And they more or less provide a solution like we have here in Spain with CIMA. While these solutions are great, there are a few handicaps. The first, which is that it's not harmonized. It's not a solution for all of Europe. So that's where EPI comes in. EPI is authorized statutory product information for human medicines. Specifically, we are talking about the summary of product characteristics, the package leaflet, and labeling documents. All of these documents are semi-structured and are formatted using the EU EPI Common Standard. And once these documents have been approved and published by the regulator, they can be disseminated via web applications, e-platforms, and of course, print. So a little bit more background about EPI and some dates. Back in 2020, we published the EPI Key Principles document. Most importantly, this document outlines the benefits of having EPI. The greatest benefit is actually having up-to-date, timely information. One issue with the paper package leaflet is that there's a bottleneck in providing that paper package leaflet to the patient. The paper has to be printed, it has to be put in the package, it has to be given to the patient. So there's a bit of bottleneck. But one benefit of EPI is that once the EPI has been approved and published by the regulator, it is immediately available to the patient. So moving on back to 2021, we approved and published the EU EPI Common Standard. Again, this is a harmonized standard to be used throughout the entire EU. It's suitable for all European countries and all languages within the European Union. It is a standard based on FHIR, that's Fast Healthcare Interoperability Resources. You might be familiar with the FHIR standard. It's used throughout healthcare. And for EPI, we are using it to structure and to store and disseminate electronic product information. Also, another factor of using FHIR is that inside FHIR, it also has profiling. And this allows us to basically create a template for EPI. And with that template, we can use it to validate product information documents to ensure that EPIs have all mandatory sections, all the sections are in the correct order. So it allows us to create a more accurate and up-to-date and more comprehensive product information documents. Moving on to 2023 to 2024, that is when we conducted a pilot. We conducted a pilot using real regulatory procedures in real time. This pilot was conducted at EMA and also the national agencies of Spain, Denmark, Netherlands, and Sweden. I will touch a bit more on the pilot a little bit later, so we'll leave that for now, which brings us to where we are today, which is ongoing development within the product lifecycle management portal. We are using learnings from the pilot to create additional functionalities to help applicants create and manage their EPIs in the portal. And in turn, when the product information documents are ready to be approved and published, they can be approved and published by the regulator in the portal. Just to touch a little bit about functionalities in the PLM portal. Within the PLM portal, applicants can author their product information documents, or if they have, a way to develop EPI in their own systems, they can bring those EPIs to the portal and import them into the PLM portal. There's also a rich text editor. So this allows applicants to create the documents using all kinds of styling, whatever they need to create their EPI. There is also an export. There's an export to Fire and also to Word. And then once an EPI has been approved and published, it's available via a centralized repository and can be retrieved via an API. API in this instance is an application programming interface. It's just a way for machines to retrieve information from the server. So going back to the EPI pilot, again, this was a years-long pilot. It involved 23 companies and the 5 regulators that I mentioned earlier. It was a successful pilot. We did not encounter any main blockers. We met all our KPIs, our key performance indicators on EPI creation, management, and usability of the portal. Of course, there were also some recommendations that were made by our participants, mainly around the guidelines around EPI, also the business processes, and the general usability of the PLM portal. So with the learnings from the years-long pilots, we are now planning for go live. For the moment, the go live would entail EMA going first with CAPS, followed by early adopter NCAs, and then subsequent rollout across the EU. We have produced an EPI pilot report. It's a comprehensive summary of the pilot. You can find it at EMA's PLM portal. So if you're interested in finding out more about the pilot, please go ahead and read our pilot report. And here's some pre-implementation work. So again, we finished the pilot and we are now in pre-implementation phase. We're using learnings from the pilot, the EPI team, along with our NCA SMEs. We are creating more guidance around EPI. We are also elaborating our business processes. So during the pilot, we tended to use more simple procedures. These are do and tell procedures. However, this is not the reality in the regulatory environment. We need EPI to be suitable for all types of complex procedures. So we are creating these business process documents right now, and hopefully they will be approved and published in the near future. And we are also, of course, developing new functionalities in the PLM portal. So once the solution is stable, we will be conducting more UATs. These are user acceptance testings. We will be conducting UATs with industry and also with regulatory stakeholders to ensure that the solution is ready for implementation. Moving on, we will also be providing feedback on our public consultation on our G10 reflection paper. We produced a reflection paper on how to provide the EPI to the patient. I have a slide on this later, so we can go back to this in a little bit, but we will be providing feedback on this paper in the near future. Of course, we are now drafting a roadmap for phased implementation. I touched on that a bit earlier. So once the implementation roadmap is a bit clearer, we can also produce that material. And of course, lastly, we have preparedness for the new pharmaceutical legislation. So hopefully within the coming weeks or months, the new pharmaceutical legislation will be published. EPI is very much included in the new pharmaceutical legislation. It dictates, where EPI will be applicable, and also some timelines around when EPI will be implemented. So here I would like to touch a little bit on the EPI business processes. This is a little bit regulatory heavy, but I know there are regulatory agencies in the audience, so it's very applicable to the agencies, but it also gives us a good idea of how EPI will be generated and then disseminated to patients and healthcare professionals. So here I have two swimming lanes. What I'm representing up top, which I've just highlighted in this blue dashed box, is the current day variation process. And this also includes the evaluation of the product information documents. So when a variation is sent to the regulator, it's sent in ECTD. This contains the SMPC package leaflet and labeling. These documents are evaluated and then eventually approved and published by the regulator. So this process will not be affected when implementing EPI. All of EPI activities are done in parallel. So what we can see down here at the bottom is that applicants will go to the PLM portal. They can use our authoring tool to draft the documents, or they can upload and import documents that have been created in their own system. They can be the EPI can be submitted to the regulator, and then the regulator will eventually approve and publish the EPI, at which point it will be available in our publicly available FHIR repository. So this will be a centralized repository holding EPIs for all medicines authorized in Europe, whether it's centralized medicine, national, decentralized, etc., whether it's an antibiotic medicine or a vaccine, all medicines will be available within the centralized repository. And then the EPIs can be available via an application programming interface to be displayed on NCA websites, electronic health records, clinical decision support systems, and third-party apps. And of course, all of these applications will display the EPI to the patient or healthcare professional. I would just like to highlight what we have down here is third-party apps, because one third-party app that will be consuming EPI is the Gravitate Health application. Gravitate Health is another project that the Spanish agency is working on. What Gravitate Health aims to do is to provide a mobile applications for patients. So this mobile application will help patients better adhere to their treatments, improve risk minimization, and improve their quality of life. So essentially what this application will do, if we could just very briefly highlight what it has, the application will have a medication list for the patient. It could also have a list of allergies and a list of medical conditions. And for example, we will have the medication list along with the EPI. And there is a focusing mechanism on this application. It's called the G-lens. And let's just imagine a patient is pregnant, and they apply the pregnancy lens on the application. What happens in the application is that the EPI will now be focused specifically on all the information around pregnancy. So we can display the pregnancy information to the patient more easily. They can more easily understand what's stipulated in the EPI around pregnancy. So it's just one way of how EPI will be used and consumed by patients. And lastly, linking EPI with the medicine. This goes back to our G-Chen reflection paper that I mentioned earlier. While it's great to have EPI, we need to have a way to display the EPI to the patient and to how to retrieve the EPI from the FHIR repository. So we produced this paper as kind of a Kickstarter, how to generate some noise and some talking about how patients can retrieve the EPI. So our solution is that on the package, on the medicines package, there's actually a data matrix code. It's this code right here. This code does contain information about the medicine. Here in Spain, it contains the Código Nacional, that is the national code. It is the identifier for the package. So the idea is that this data matrix code can be scanned by your mobile phone, or it can be scanned with the app, like the Gravitate Health app. It will extract the national code, that is the identifier for the package. The mobile application will then match the national code with the EPI that is found in the FHIR repository, the EPI FHIR repository, and we can display that information to the patient. So this was kind of our idea on our proposal on how to provide the EPI to the patient. This is a very quick summary. It's quite a more complex solution on how to get EPI to the patient. But if you're curious and would like to know more information, please review our reflection paper on linking EPI with the medicines package. So that is the end of my presentation. If you're interested in EPI, please stay tuned. We have quarterly system demos. These are system demos hosted by EMA. It's where we demonstrate the most recent updates and developments for the EPI project. So please, if you're interested, stay tuned for the next system demo, which will be in March. So thank you very much for having me today.
Thank you so much, Kevin. Thank you so much. There is a question on the chat, but has been already answered by Cristina Muñoz about the any electronic product information in veterinary field. Are you aware that it's going to be extended to the veterinary medicines at the European Medicines Agency level?
Yes, I mean, eventually that will be the natural evolution of EPI. For the moment, it is human medicines only. But of course, in the future, we will provide EPI for veterinary medicines as well.
Thank you so much. I don't know if I didn't give the opportunity to make questions, but I think it's going to be at the end of the presentations. Blanca, yes? Or if there is any question to Evin right now?
Antonio, we thought that we might get all the questions together at the end.
Perfect. Okay. So now I give the floor then to Sonia from the Ministry of Health to give some legislative strategies that we are conducting at the Ministry of Health level regarding AMR and antibiotics. Sonia, the floor is yours.
Hi, good morning. Thank you. I will share my presentation first of all. Let me. Can you see the presentation now?
Yes.
Okay. So good afternoon, everyone, and thank you for the opportunity to do this presentation. Today I will focus the presentation in the legislative measures related to price and reimbursement of medicines in which we are working in Spain. First, I will introduce a little bit myself and Mercedes, the way we work, the place we work. We work at the General Directorate responsible for decision-making regarding provision within the healthcare system, and particularly decisions on price and reimbursement of medicines. So to put a little bit of context for the presentation. So the strategies in which we are working for the future focus mainly on two objectives. The first one would be to reduce vulnerability of the supply chain, And the second one is to incentivize the development of new antimicrobials. Regarding the first objective, we see that we can have a considerable impact with measures that we take at local level. So this is trying to promote competence, to promote strategic autonomy within our market. However, regarding the second objective, we see that our contribution is very important, but it's only one piece of a bigger puzzle. Since promotion of development of new antimicrobials is something more global, it is relevant that we are coordinated at a higher level. And I think this is a very good for today to have this opportunity to exchange views and coordinate ourselves at regional level. Regarding the first objective, vulnerability of the supply chain, we identified that the most relevant challenge we need to overcome is the shortages that Patricia already talked about. As she mentioned, shortages are a complex issue with multifactorial causes. However, one of the main reasons for shortages that we identify is price erosion that affects medicines that are off patent, for like more classic antibiotics. So by reducing prices, markets become unattractive for suppliers, and the suppliers may leave the market, resulting in less and less competence. In addition, manufacturing sites that are based in Spain or in Europe may become at risk due to lack of profitability, and this leads to supply issues. This is what we have seen, let's say, like empirically, from the perspective of a price and reimbursement authority. And I can give you a particular example of a company producing antibiotics with a manufacturing site in Spain. They came to our offices a few weeks ago. They told us that they had a very low profitability, and that one of its production lines, and they were having even losses, and that they might have to close this line. And of course, we don't want this to happen because this put at risk supply of antibiotics in Spain and the strategic autonomy in this context. One of the reasons for price erosion is the reference pricing system that we have in Spain that is set in our legislation. I'm going to explain a little bit what's the reference pricing system that I guess you might have also in some of your countries. And this is once we have one generic or biosimilar of a medicine, or after 10 years of the authorization of a medicine, even if it's centrally authorized or in any member state, we set up a reference set. And this reference set includes at least 2 medicines that share the same active ingredient and the same route of administration. And then the reference pricing is calculated for the whole set of medicines, for this set of medicines. And these sets and prices are reviewed annually. I'm not going into much details about the calculations. However, this leads to consecutive price reductions every year. And for many suppliers, this implies low profitability and even leaving the market, as I mentioned before. For you to have an idea, the price under this reference pricing system can go as cheap as 1.6 euro ex-factory price for a medicine. Also within the reference pricing system, just mention that there are special reference sets for pediatric treatments, for medicines classified for hospital use, for medicines dispensed at hospital pharmacy services, and for clinical packs. And there are also exemptions. However, given considering a detailed interpretation of the law, exemptions were being made in very, very few cases, because also the bureaucracy behind was very complicated. And in addition to all this, the legislation also mandates that the community pharmacy should dispense the cheapest medicine for those medicines that could be therapeutically equivalent. So this all together result in lower and lower prices. So what are the legislative measures that we are working on? So the legislative measure that is already in place, that was put in place a few months ago, give us further flexibility to review prices upwardly at any time and when we consider it necessary. So this is provided in a law that is not really related to price and reimbursement, but we needed to make this change, and this law served us to introduce a final provision in this regard. And what it says is, like, for strategic medicines recognized as such by the Spanish Agency of Medicines and Medical Devices, we may upwardly revise its price. And I was going to mention about what were strategic medicines, but Patricia already mentioned this strategic medicine list that is elaborated by the Spanish Medicines Agency. Another legislative measure related to price of medicines, to price and reimbursement, is this one. This is, well, we are working on a new law on medicines and medical devices, because the basic law that is in force is from 2006. So modifications have been introduced during all these years, but the main text has already 20 years. So we needed to modernize the medicines ecosystem and to respond to today's challenges, including AMR. We are also trying to incorporate lessons learned from the pandemic, and we are writing something that serves for the future, balancing patient needs and sustainability of the national healthcare system. And one of the main changes that we incorporated in this draft bill is related to the criteria that is taken into account for the public funding of innovative medicines. So we included a number of new criteria, and one of them is reducing antimicrobial resistance. So as I say, this would affect mainly innovative antimicrobials rather than classic antimicrobials. And just mention that all these criteria for the moment are like qualitative criteria, but we want to work in a mechanism that allow us to quantify the contribution of each one of these criteria in the final decision. So let's see how this evolves in the legislative procedure to be approved. Another measure within this draft bill is related to public procurement procedures. And when we talk about public procurement, we are mainly talking about procurement carried out at hospitals. And this affects mainly of patent medicines. Our criteria should, for this public procurement, should balance further criteria other than price, because prices has been traditionally very highly weighted. So now we want to change that and give other criteria some more weight, such as quality or strategic autonomy. In this regard, also we will write, or we would like to write a public healthcare procurement guide with recommendations with special emphasis on efficiency, sustainability, agility of provision, strategic autonomy, and environmental character. And although AMR is not explicitly mentioned here, public procurement would affect, as I say, classic antibiotics, and it gives us the possibility to promote strategic autonomy and reduce vulnerability in the supply chain of antibiotics. Next slide. Here I am going to introduce a different measure that was already introduced by Antonio. This is already in place, and it's the strategy of the pharmaceutical industry 2024-2028. And the pharmaceutical industry strategy brings together the ministries that can impact on manufacturing and development of medicines. It sits together main industry associations, including innovative, generic, and biosimilar medicines, and key stakeholders such as healthcare professionals and patients. So in particular, we have 3 levels for discussion within the strategy, and this is the interministerial committee, and there is the Ministry of Finance, Ministry of Economy, Ministry of Science, and the Ministry of Industry, together with the Ministry of Health, of course. Then we have the mixed committee, that is all these ministries together with industry. And then we have the alliance that involves all stakeholders. And we work around 3 strategic pillars, that is patient access and healthcare system sustainability, research, innovation and development, and competitiveness and strategic autonomy. And again, although AMR is not explicitly mentioned here in the pillars, but it is within the rationale of the strategy to fight against AMR, and is one of the main priorities of the strategy. So these fora allow us to raise awareness among other public representatives about the importance of this problem and to try to find solutions together. For example, regarding the company that I mentioned at the beginning, that they were at risk of closing, at risk to close a production line, we set up a communication channel with the Ministry of Industry to try to find solutions from both sides. Then finally, I will talk about another legislative document in which we are working at the moment, that is the Royal Decree on Price and Reimbursement. In this case, there is no legislation in place yet. So this is a completely new document that will try to consolidate and modernize again the administrative procedure that regulates the inclusion of medicines in the pharmaceutical benefit. So at this stage, we are planning to include a specific section or chapter regarding reimbursement of antibiotics. So we are now in the process to define the model that best aligns with our context. In this sense, it is important to take into account that we are 17 autonomous communities, 17 small regions with the competence over the healthcare budgets. So it's important that we find a model that everyone agree with, and that we can find financial coordination mechanism for Spain. To find the right model, we keep our eyes open to learn from other countries. Again, I think this fora is ideal for this. And we are also working with an advisory committee on pharmaceutical benefits that give us a more evidence-based and academic perspective. With this, I will conclude my presentation. And thank you for listening, and I will be happy to address any questions or comments that you would like to raise.
Thank you so much, Sonia. This new legislation related to medicinal products and medical devices is quite important because, at least also from the Spanish Medicine Agency, it covers all the competencies that the Spanish Medicine Agency has. And we also included some provision for ensuring appropriate use of antimicrobials, such as linking the use to having an antimicrobial stewardship at the healthcare level, and to prescribe according to link the prescription according to the national guidelines on antimicrobials. So this new legislation is quite important for both parts, from the access, the Ministry of Health, but also for the marketing approval and all the provisions for medicinal products and medical devices. So thank you, Sonia. Now I think Mercedes will cover the pricing strategies that, again, the Ministry of Health is conducting regarding antimicrobials and in particular antibiotics. So Mercedes, please.
Yes, thank you very much, Antonio. Thank you all my colleagues, and thank you all of you. Good afternoon. And thank you for giving us the opportunity to share with you our roles and our experience in this scope. So I'm going to share my presentation. Yes, it should go ahead. Can you see it?
Yes, but it's not in presentation mode.
Yes. Now?
No, yes, thank you.
Okay. All right. So I would like to first share with you, but I'm not able to advance, to go ahead. Sorry.
Maybe, Mercedes, if you go back to
To the previous mode.
yes, and let's see.
I'm sorry for that.
Right.
Can you see it now?
Yes.
But not as full mode?
No, it's not passing. It's full screen.
It's full screen?
Yeah.
Yeah. Yes.
Yes, it is full screen, but
okay.
I can't see the slides moving. Are you moving them or not?
Now?
I do not see them moving, no.
It's okay. We don't have to have it in full screen mode. I think just put it back into the one where we could see it before.
I'm so sorry. Can you see it now?
Yes.
Yes, perfectly. Thank you.
Okay, thank you. So first, I would like to give you a little background about, especially focusing on pricing committee, which is the base of all that we work on, and what is the general framework for pricing and reimbursement model in Spain. So, and then we'll move on to what is in general the pharmaceutical pricing strategy focused on antibiotics and critical and strategic medicines. And Spain is done and is doing and has done in the previous years. So this focusing on the pricing committee. A pricing committee is an independent body which is linked to the Ministry of Health in Spain and is composed by 25 members. And it's composed by all the ministries involved in this process in Spain, such as the Ministry of Health. As we have 4 members, we have the presidency and the vice presidency. It's also the Ministry of Economy with 1 member, the Ministry of Finance and Budgets, which has 2 members, the Ministry of Industry, and 17 members, 1 of each region or autonomous community in Spain, which are payers, as you may probably well know. And the activity of the pricing committee has been very intensive in more than 32 years. It has been approximately, we will have the next one next week, 262 meetings by now, and it operates under the criteria that the Spanish medicines law sets, which is we're going to see to review later on in the next slide. But the main criteria, maybe we could say that there is a pillar composed of these 5 main criteria: the therapeutic and social value, the cost effectiveness, the budget impact, the innovation degree, and maybe the contribution to GDP in some extent. And the pricing committee publishes some statistics that we can see at the website, such as the minutes after every meeting, the main agreements, the public reports of evaluation, etc. And focused on the procedure for pricing and reimbursement of medicines in general, not only for antibiotics, but extended to all innovative medicines and all kinds of medicines. And we can find that the pillar is the legislative royal decree 1 of 2015, which refunds and reforms the original law, or the former law, which is the law of guarantees and the rational use of medicines and healthcare products or medicinal products, which is the law which was published in 2006. The original one is the former law was published in 1990, but the law of 2006 has had several reforms 4 years. This is why our legislative royal decree has reformed in 2015 and is the current legislation for us, currently applied for reimbursement and pricing of medicines. And the Title 8 specifically regulates the public funding of medicines throughout the Article 92 public funding procedure. And we have, as Sonia previously mentioned, what would be ideally some other criteria. We already have 6 main criteria nowadays, which try to modelize all criteria or characteristics that had to be in mind and had to take into account once a new medicine is intended to enter into the market: the severity, duration, and sequels of the pathology, the specific needs of certain groups of people, such as a rare disease, etc., the therapeutic and social value of the medicine, and the incremental clinical benefit, taking into account the cost-effectiveness ratio, the rationalization of public expenditure devoted to pharmaceutical supply, and concretely the budget impact of the national health system, the existence of available reimbursed therapeutic alternatives, medicines for the same pathology or disease at lower price of treatment cost, and innovation degree. All of these criteria could be related to the unmet medical need that the pathology represents, and the new therapeutic approach could intend to treat or to approach. So, summarizing, the pillars for public funding or reimbursement of medicines are 4: the cost effectiveness analysis, the budget impact, and the social value of the medicine, and the therapeutic and technological innovation degree or aspect. And if we look at the pricing criteria, we can find that these criteria are included in the Legislative Royal Decree 1 of 2015, concretely also in the Title 8 throughout the Article 94 pricing that says that pricing, which is a competence of the pricing committee, but the pricing committee fixes prices and recommends to the general director of pharmacy, this is us, the reimbursement of this new medicine at that price. And this is done on the basis of the previously mentioned criteria that the Article 92 sets or mention, and there might be dual price for innovative medicines, and there might be recovering mechanisms such as discounts, paybacks, reviews of prices to down for innovative medicines in order to maintain the sustainability and the affordability in the national Spanish system. And regarding pricing reviews, specifically, the Article 96 sets that the price might be or could be reviewed when changes in either economical or technical and health-based circumstances come up. And this applies for prices to down and for both prices to down and prices to up, which is the interesting thing in this scope that we are talking about today. Summarizing, what would be the criteria for revision of prices to up, for instance, for antibiotics or other kind of medicines that we consider as strategic and critical because of their permanence in the market is helpful for patients and for our system. And if they would disappear in the market, it would be an unmet medical need, something like that. So these prices reviews to up are guaranteed or are possible throughout this legal basis. The own Article 96 that we have seen before, and the Administrative Procedure Law, which is the 39 of 2015, and the Royal Decree 271 of 1990, which is the regulatory basis for pricing intervention, and is based also on the Transparency Directive, which regulates the transparency on prices, which is the, as you may know, 105/1989 Transparency Directive in the European Union. So all of these allow medicines with problems to be supplied in the market have higher prices than before. And pricing committee, which is the body, has been established criteria to these revisions to up. For instance, that lack of affordability, as maybe colleagues have been mentioned before, lack of profitability for the manufacturer due to the increasing costs in all the chain, such as raw materials, production and distribution costs that lead to final price. And the price is very low, or there has been a price erosion, and there is no possible alternative. The medicine is alone in the market, and also we assess the therapeutic usefulness, the therapeutic value, the clinical benefit for this medicine. And normally, these kind of medicines are related to a big clinical benefit. So, and there are also margins established to these price revisions in percentages to have fulfill in order to grant the price revision, because of the budget impacts, it could be considerable in sometimes. So if let's move on to what would be the pricing strategy in this sense for guaranteeing antibiotics to sustain and to supply in the market. I know that this general directorate and this ministry has done big efforts and has paid attention much to this scope, to this scenario, to this topic, because considers that antibiotics and other kind of strategic and critical and essential and usefulness medicines are important enough to be maintained to the market. And this is why price revisions to up are allowed. And in the previous years has been these medicines, these antibiotics have been reviewed. For instance, in 2009, in 2021, doxycycline, but I can't see very well, sorry. This trimethoprim, doxycycline, etc. in 2022. Septrin as well, Benoral, Benzil, penicillina, cephalosporins, etc. In 2023 could be these ones, including trimethoprim as well, again, nitrofurantoin, amoxiclavulanico. In 2024, penicillins, sulfamethoxazole, trimethoprim as well, cephalosporins, and 2025, this one, anaclocinal, norvenin, Septrin, and in 2026 is ongoing. Indeed, in the next pricing committee, there will be amoxiclavulanic strengths that are going to be reviewed probably. And what have been there, or what are the margins or the ranges? The ranges could be between 4 and 60% in terms of percentages, in relative terms, and maybe as an average 25% or 30% of increase. But there might be other previous revisions the previous year, so this is not at exclusion. This is not limit to ask for this, which is a very important thing. And there is a rational approach to review these medicines. For instance, there might be a percentage, a big percentage, for instance, 100% in the price or 200% even, distributed in several exercises, for instance, in 3 years, or 4 or 2 years, depending on the negotiation with the manufacturer, in order to do an affordable provision in the price committee, obviously, and guaranteeing a budget impact and a budget impact affordable. And even more than 200%, some cases has been applied, especially in 2019 year and 2018, maybe because of more problems with shortages, or because shortages is one of the most important reasons to ask for this, or to pay attention to review these prices. And finally, other actions. Sorry, yes?
Maybe just 1 more minute if we can, so we can get some discussion as well.
Yes,
Thank you so much.
Yes, I'm going to finalize, yeah. Other actions besides price reviews that the General Directorate of Pharmacy takes into account to support access is, or to help antibiotics, is to strengthen the policy on access for new antibiotics. For instance, all of new antibiotics that have been authorized through centralized procedure have been reimbursed in Spain, which is 100% of coverage. There are here all of the new ones. And another action is shorten timing to funding the new ones, trying to speed up the reimbursement and pricing process. For instance, below 6 months, 180 days. So this would be all on my side. Should you have any question or remark, please don't hesitate to contact us. And